And your second question is going to be analyzing these cues, or then considering what could they mean, what disease processes would create these findings. We've got a white blood cell count, which is 15,600, so that's elevated. Our hemoglobin, 15.5, so that's in our normal range. We were somewhat concerned about this blood in the stool, but now I see he's not anemic. I'm less concerned about that. For each client finding, click to specify if the finding is consistent with the disease process of diverticulitis, appendicitis, or ulcerative colitis. You'll remember from our item types video that we approached this style of question by treating each column as its own select all that apply. And so quickly, I just want you to note they're all itises. We have a diverticulitis, an appendicitis, and an ulcerative colitis. So these are all inflammatory or infectious conditions of the GI system. So diverticulitis, some clients will have diverticulosis, where they have these outpouchings in their sigmoid and descending colon. And that can be completely asymptomatic, but it becomes problematic when they develop diverticulitis. And that's when that lumen of that outpouching becomes obstructed, and this gets swollen and painful and tender and can start to erode the blood vessels and cause blood in the stool. So now knowing that, let's treat this like a select all that apply. So diverticulitis, will it cause fever? Well, we just discussed how it's infection, inflammation, and anything that causes infection or inflammation can cause fever. So yes, I would expect to see that. With that swelling and diverticulitis, you're going to have erosion of those blood vessels. And you'll remember from anatomy, your descending colon tracks down the left side of your abdomen, and then your sigmoid connects it to your rectum. So right there, right before the rectum is where this is happening. So that blood is going to look more fresh in the stool and is more likely to appear as these streaks of blood that he's having. So yes, I would expect to see blood in the stool with diverticulitis. Being more common in elderly clients. Yes, being obese, which he does have a history of obesity, and then being elderly are the two major risk factors for diverticulitis. So yes, I would expect this to be more common in elderly clients. And then abdominal tenderness to palpation. We'll consider this together with the next one, left lower quadrant abdominal pain. This is happening in that left lower quadrant. And if it's inflamed, then it's going to be tender when you palpate it. So yes, I'm going to expect to see abdominal tenderness to palpation and left lower quadrant abdominal pain. For appendicitis, same thing. Appendicitis, this is going to be in the right lower quadrant, if you remember there, McBurney's point, where the appendiceal lumen gets obstructed either by lymph tissue or feces, and then same sort of idea, that obstruction starts to build up pressure, inflammation, infectious material behind it, with the fear that it might rupture. So an infectious inflammation process, yes, it's going to cause fever. Blood in the stool. So this is much further back in the GI tract. At this point, any stool passing by the appendix still has to go through your entire large intestine. So even if there might be a trace amount of bleeding at that site, you wouldn't see it as blood in the stool. And then being more common in elderly clients. So appendicitis is probably one of the more feared acute problems of the GI tract in young people, right? This is something that we really commonly see in children, in teenagers, adolescents, and young adults. So no, this is not more common in elderly clients. It's more common in young clients. Because this is in that right lower quadrant, and diverticulitis can look really similar in the left lower quadrant, diverticulitis is sometimes called like a left-sided appendicitis for that reason. And then we just discussed how this occurs in the right lower quadrant and is different from diverticulitis from that reason. So I'm not going to select this one, but abdominal tenderness to palpation is the hallmark of appendicitis. You might remember some of those special maneuvers you can do, like the Rovsing maneuver where you palpate the left lower quadrant and then you have pain on the right side where that appendix is. So I'm going to have abdominal tenderness to palpation. It's just not going to be in the left lower quadrant. And then finally, ulcerative colitis. This is one of the two types of inflammatory bowel disease, with the other one being Crohn's disease. And ulcerative colitis being a problem primarily of the colon, it starts in the colon or the rectum and then ascends. So just like diverticulitis is happening in our very distal colon and the sigmoid and descending colon, that's the same place you're going to see these findings in ulcerative colitis. So inflammation, eroding the vessels, bleeding, happening in a similar place to this diverticulitis. So yes, it's an inflammatory process we're going to see fever, especially during an acute flare of ulcerative colitis. Blood in the stool, same idea. It's damaging those vessels locally by ulcerating into the intestine wall, and we are going to see blood. In fact, a lot of blood. And then being more common in elderly clients. This is something that shows up as being most problematic in pretty much people under 30, young adults, adolescents. So no, that's not more common in elderly clients. The only one of these that is more common in elderly clients is the diverticulitis. And then abdominal tenderness to palpation and left lower quadrant abdominal pain, inflammatory process of the colon. Yes, you are going to see tenderness to palpation and your pain is going to be localized to that left lower quadrant. And we're correct.